I was asking my colleagues about what they thought about exercising as we age. And some of my colleagues said, talk about balance, while others said talk about case studies or aqua therapy. And one of my colleagues in particular helped me kind of really find my focus by thinking of that kind of common 50-year-old patient that comes into the office upset because he feels like his or her body are just kind of giving out on them. And they're training the same way that they were training when they were in their 20s, but they just don't seem to be recovering quickly enough, and they've been tending to getting more injuries. I know that I swam in college, and we were dedicated to swimming about 3 to 5 hours a day in the pool. There's just no way anybody has that kind of time now to devote that much amount of time to training. So why are we expecting our bodies to train and to work as hard as we were pushing them when we were in our teens and 20s? So the objectives are to discuss normal-related changes as we age, issues related to older training, to older athletes which affect their response to training, and training strategies and how they can be modulated. So this is a slide from Foster and his colleagues in 2007, which found that little loss in performance ability has been documented in athletes before they reach their mid-30s, although athletes commonly report more difficulty in avoiding injury or persistent problems related to prior injuries as early as their late 20s and early 30s. From the mid-30s to about the age of 60 years, a slow but progressive loss occurs in performance ability. Beyond 60 years, an accelerated loss in performance ability has been observed even in athletes who are able to maintain their training volumes. So here's the warning. The next couple slides are a little bit of like a Debbie Downer as to what happens to our bodies as we age, but it'll get picked up about what we can do. So, age-related changes. Sarcopenia, which is characterized by muscle loss, muscle weakness, and increased fatigability. With age, there is an inevitable reduction in the ability to produce and sustain muscle power. This is of importance as it impacts posture, gait, and the ability to perform activities of daily living and the performance capacity. In general, muscle mass decreases approximately 25 to 30% from peak values by the time you're 65 years old. This reduction in muscle cross-sectional area is accompanied by increases in non-contractile structures such as fat and connective tissue. The total number of muscle fibers significantly decreases with age, beginning at 25 years old and progresses at an accelerated rate thereafter. In recruitment, most reduction in muscle fiber cross-sectional area is seen in type 2 fibers. In the older adult, type 2 fibers are rarely recruited and are subject to disuse atrophy. So issues related to older athletes that affect their response to training are the presence of underlying pathologies related to age, the presence of residual injuries, reduced hormonal concentration, the need for longer recovery times from hard training bouts, lack of available time for training, and reductions in type 2A and 2B fibers. So, what can we do? Long and slow training comes with problems, including injuries, boredom, and wasted time. People get beat up by long slog programs. At 40-something, a 40-something-year-old dad grinding out a 16-mile run on knees creaky with fraying cartilage need and deserve another way up the mountain. Traditional training is a recipe for plateaus, inattention, and overuse injuries. Optimal training in older athletes is fundamentally similar to optimal training in younger athletes. And what this has been trending towards is high-intensity training. High-intensity training involves altering brief bouts, 30 seconds to 5 minutes, of higher-intensity sessions with either rest or lower-intensity workloads throughout an exercise routine. And then, so the kind of nuts and bolts of the high-intensity training are the HIIT sessions per week. So in the beginning, you want to start off with 1, and then you can progress to 2 to 3 times per week. The number of bouts meaning if you're going to be doing 4 bouts of 60 seconds, the intensity of bouts, which you use your maximum heart rate, the duration of each bout, so you can start off with 60 seconds again, and you can work up to, or 30 seconds even, you can work up to 3 minutes. And then the most important is the recovery between sessions. The benefits from this high intensity training include improvement in VO2 max, improving endothelial function, blood glucose control, and fat metabolism, preservation of muscle mass, and is more likely to be associated with recruiting those type 2B fibers, and increased pulsatile secretion of growth hormones. And so one of the papers more recently in 2017 is from Robinson et al., in which they divided groups of people aged 18 to 30 and aged 65 to 80. They were put through 3 months of either interval training, weight training, or a combination of the two. And the results found that after 3 months, the interval training group increased the ability of the mitochondria cells within to generate by 69% in the older volunteers and 49% in the younger group. So, making this applicable to everybody. Training with a pattern of, what we can do is we can train with a pattern of 30 seconds on, so that high intensity, with a 60-second rest period or a lower intensity training program. And those results have shown that, that this is safe to do even in patients with chronic heart failure, which is severe enough to require cardiac transplantation. Strategies that make resistance more tolerable without decreasing the absolute intensity of training might be useful for preserving muscle mass and type 2B fibers. For example, performing 2 sets of 5 repetitions instead of the 10 repetitions. Older athletes may need relatively more recovery, suggesting that the frequency of either high intensity or high volume training might need to be reduced compared with training in younger athletes. In older athletes in whom microtrauma resulting from either prolonged or high intensity specific training might require several days of recovery, cross-training has been particularly valuable. Cross-training used as a strategy to avoid orthopedic stress may be more helpful than the strategy of low-intensity training between heavy-intensity training sessions used by younger athletes. So Laird Hamilton is in his 50s. He has revolutionized the big wave surfing. He also, he and his wife both recently had their hip and their knee replaced. And he has been, like I said, he's been surfing for almost a half century. They've created a program in which to live a limitless life. The program utilizes breath control, high intensity training, mobility work to improve and preserve joint motion and health, as well as ice baths in order to train at a high level while minimizing risk of injury. The program is based off of a 7-day schedule. 2 to 3 days consist of a high-intensity training workout. There are 2 days of rest, which include mobility and stretching work, and a day of being outside, hiking, walking the dog, doing whatever you want. So Oxana, I'm not going to pronounce her last name because I will butcher it. So there might be no other athlete in history who has defied the odds in father time. So gymnastics is an especially demanding on bodies, with many athletes reaching their peak performance in their teens and early 20s and retiring soon after. In 2016, Oxana competed in her 7th Olympics at the age of 41. When asked about how she has been able to compete at such a high level, Oxana credits the possibility of having good genes, as well as shifting her attention from hours spent in the gym to visual mental training. She said that her body knows what to do. It's her mind that she needs to be able to control. And the last is Dara Torres. This is from a New York Times article that Torres is getting older but swimming faster. During an interview in 2008 in which Dara Torres was asked how she was able to continue to train and compete, she responded, "I had to dig deep inside of myself, rethink how to train my body, and ask new questions about what makes a person stronger and more flexible in body and in mind. In other words, I had to understand how not to let my age get in my way." According to the New York Times article, Torres' training is cutting edge so that her personal pharmacy does not have to be. Similar to the training methods of Oxana, Dara's training for the 2008 Olympics included less time in the pool. And rather, it focused on strength and conditioning programs, which included Swiss balls, medicine balls, and resistance bands and cables. The goal of the strengthening program was to stimulate her nervous system and strengthen her core muscles through a variety of multi-joint movements. So just in summary about the high-intensity training, the problems faced by older athletes include reductions in VO2 max, sarcopenia, loss of type 2B muscle fibers, but things that we can do to continue to address these problems include training strategies at the high intensity, and then modulating that so that it can be more accessible and prevent any kind of injury, as well as cross-training. So, thank you.